I am Firas Darawsha. I am physician here in Sheba. I am a thoracic surgeon, a specialist. I am from Israel. I am Arabian. I am from Iksal village. It's a village, very nice village in the north, between Nazareth and Afula. My dad is doctor and my mother is a teacher. We have ancient origins here in Israel, in this land. I love this land. My wife also is a doctor, and I have 3 children and 3 brothers. Yeah, I am 2.5 years in Sheba. The work is so versatile. We first of all we work with all of the ages from 0, even minus. We did some operations to premature. And until the late 80s, early 90s even, we do a lot of surgeries, starting from benign diseases, chest wall, and we do also for cancer. That is the main part of our work: lung cancer, esophageal cancer, lung transplantations, and trauma, especially in this period. I have to say that we are not used to these injuries, but we treated them well. Most of the traumas here that were operated were due to bleeding, and some due to infections that can develop later on after the initial injury because of retained blood. We see a lot of lung injuries, bleeding from the chest wall, hemothorax, which is bleeding in the chest, a lot of pneumothorax, which is free air in the pleural cavity. We see a lot of empyema, which is infection in the pleural cavity, especially if there is retained blood that can be infected. And we had also rib fractures. We also had some soldier with a bullet in his pericardial cavity, that we had to do for him emergent thoracotomy, opening the chest on the left, and the evacuation of the blood and blood clots. And then we had to take out the bullet from near the heart. First of all, it affected us outside the hospital to live in wartime. It's different from peacetime or from calmness time. When you come to the work, when you hear news only about war, when you hear news only about number of casualties, number of dead, number of injured, it causes you a lot of sadness, because it's the opposite of what we are doing in the daily basis. Our job is to save lives, is to help people. We all get glad and we all get happy when we save someone's life. This is a different atmosphere, it's a different environment. You see the anxiety in your co-workers and the stress. Everything was influenced negatively. A lot of co-workers here have the relatives in the army. You see that everyone is concerned and worried. You can't disconnect yourself from all what's happening in the outside. We are used to come to work to talk only about work. But in these times it doesn't happen, unfortunately. It's opposite to our work. This atmosphere is not suitable to our work. We work for peace. We work for saving lives. We don't know who is Arabic, who is Jewish, who is Christian, who is Muslim in our work, and war is the opposite to this atmosphere. Yeah, it's very difficult. I think that it spurred me to work harder and to save more lives. I would be more glad also to save more lives or to help more children and women in both sides. Yeah, let's say the truth in both sides, and I'll do my best to do that. And I'm very happy that we are doing very good work. The cooperation here between the doctors, the nurses, and everyone in the staff, between the surgeons and the anesthesiologists, is very, very good. And I am proud of it. And I am proud to work in Sheba. And Sheba, historically, has treated a lot of people outside Israel, from the West Bank, from Gaza. And I was very proud to take part in these treatments. And we had a lot of patients from the West Bank and from Gaza. Dr. Kramer and me operated premature of 24 weeks, weighing 1 kilo and 400 grams from Gaza. And we did for him a surgery that hasn't been done in the world, which was a salvage lung resection, left lung resection. And the child recuperated very well here in the intensive care unit, the pediatric. And he was sent home after a short period, and it's only one example of a lot of examples. 1 week ago we operated the child 2 years old from the West Bank, and we did for him a partial resection of the right lung. I think that this war had far more bad news and atrocious news and horrible news than previous wars. We are humans, yeah, we are doctors, but first of all, we are humans, and yeah, it caused us to be sad. It caused us to think, where do we live? These things run in our minds in all time. So we treated her child operatively, surgically. We operated him to remove shrapnel, and this child witnessed the killing of his father in the 7th of October. And when we wanted to talk to him about the operation with his mother, we had to treat him very gently and to be far more sensitive than usual. It was my first time that I treat something like this. We had to be very sensitive. We talked with him, 3 doctors in once. We talked with him, with his mother. We had to be very sensitive, sympathetic to him. It's a very difficult and very different case from what we are used to. He had a very close social worker, and yeah, it was very complicated, but I'm very proud that we succeeded to do it well. And he was operated successfully and was sent home after 2 days. But I think and I hope and I believe that when things will be over, everything will come back again to what was before the war, and we will continue to treat everyone that needs our help from all over the world.